All right, my next guest, one of my favorites, used to be my doctor, in fact, but now he's an administrative guy. So, but he's still a doctor. Dr. Michael Maxwell joins us, and he is the CEO, the executive director, if you will, over at NOHN, in the North Olympic Healthcare Network here locally. We got him in to talk about a couple of things. It's actually, coincidentally, the 60th anniversary of National Health Center Week. It's also the 10th anniversary of NOHN, which, right. So congrats on that as well. So it's great to see you again, Mike.
Great to be here, Todd. Thanks for having me.
So first of all, let's explain to folks what a health center is in this sense.
Absolutely. This is a great opportunity. This Health Center Week was established so that people like me could get out to communities and help to kind of spread the word about actually what is a health center, what it does, what makes them unique, and for us, just getting a chance to let the community know that there actually is one in Clallam County. So that's it's a chance to educate, a chance to celebrate. There are some big accomplishments and impacts that health centers have, and so we can touch on some of those things.
So NOHN specifically came in here, and you're one of the young ones.
So what behind the ears, yes.
Right.
Yeah.
So this is the health centers have been around for a while. You have an interesting story here because most people may know you. How I first got to know you, you had a private practice and all of that. You made a really steep decision to enter into this.
Yes, and I'll dive into. Our journey will make more sense after I give a little bit of background on the history of health centers first.
Okay.
So many may not be aware that health centers started. The idea started in 1964. The legislation was actually signed in 1965 by President Johnson, and it was rooted in the civil rights movement. It was part of the desire to get amongst all the other rights that wrongs that need to be righted. One was getting health care into underserved communities, rural and inner city, urban mostly. It was predicated on the idea that healthcare was a basic human right, and there's still some who may not believe that, but that was part of the philosophy back in the 60s, and that really underlies the spirit of the health center movement. The goal was to make sure that communities had access to healthcare, regardless of your race or your economic status or your location. It was wanting to make sure that everyone got access to health care. It was interesting. It started as the health center program started with 2 health centers. One was in inner city Boston. The other one was in rural Mississippi. And from those 2 health centers back in 1965, they opened up in December 1965. From there, the program has expanded under every administration, bipartisan support, over this past 60 years. Until now, there are 1,500 health centers across the country, collectively serving 32.5 million people. So 1 out of every 10 Americans gets their care in a community health center. 1 out of 8 kids. There's 3.8 million seniors, 420,000 veterans, and 1.2 million people who don't have homes. And 40% of health centers are in rural areas.
Interesting. You take that out of the equation. I mean, that's a tremendous hole that is being filled by having these available.
Absolutely, and that's it's why we exist. And it was that history and that philosophy that really drew me as a physician and my partners at the time into being attracted to this model. And I'll dive into that in just a moment. Yeah.
Because it was kind of crazy at the time. I think people are going, wow, you're going to do that.
What's he doing?
Yeah.
Why?
Yeah. But I think as you fast forward to here in 10 years into this, NOHN has done a lot of this, what you're just talking about. I know a ton of people that probably could not get care if they didn't have NOHN. They can't find a doctor in any other sense. It's been helpful, to say the least.
It gets at the one of the core drivers for health centers. So when you can't just wake up one morning and decide, I want to be a health center. It's a process, and it's a competitive process, and there's a lot of steps to go through. And one of the key fundamental features in this process is that you have to be in a what's called medically underserved area or population. And if you remember back in the not so good days of 2014 in Port Angeles, if you did not have a doctor, you were not going to get a doctor.
Yeah.
Didn't matter if you were insured or not. There was just
that we're not talking a waiting list. That just meant
period.
It wasn't going to happen.
Right. Yeah. And it was heartbreaking for us to have to turn people away, but there's only so many people that any physician or provider can take care of, and it was really a reflection that Clallam County, Port Angeles, was a medically underserved community.
And with that, I mean, I remember having these conversations with you back in 2014 when you were doing this. This was your way of being able to expand. I mean, independently, you couldn't really do this. You wouldn't be able to pull this off if you were to just, you and your partners kind of say, hey, let's see if we can add a few doctors and do what we can.
One of the challenges that we had to accept was that the model that we'd used for so long, that America used for so long, this idea of a private practice, in a rural area in particular, it just doesn't, it was just no longer viable.
And the pay mix has a lot to do with that too, right?
Payer mix plays a big part of it, but for Clallam County, it was just there just weren't enough people getting enough providers. Trying to attract a primary care provider to a rural community, regardless of the payer mix, is an uphill battle, and to attract them to a private practice where you have to buy into the practice, you have to commit your evenings and weekends to running the business. That model had lost its luster, and it was very challenging to get people to look at coming into Port Angeles. Right. So that's when we looked at doing something fundamentally different.
So you did. And how long did it take? How long was the process for NOHN to get approval?
It just so happened that good timing was in 2014, HRSA, the Health Resources Service Administration, that's the federal entity that oversees the health center program, every once in a while it will get additional funding to expand the number of health centers in the country. Those are called New Access Point grants. And in 2014, through the Affordable Care Act, so Obamacare, it actually created new funding for HRSA to open up more sites around the country that could demonstrate that they had a need, and we did. So those grant announcements were done in 2014. And so we had about 3 months to put together an application to talk about that we understood what the needs were, that we had a plan for addressing those needs, and we put in a competitive application. And at the time, there were something like 2,500 applications, wow. And we were one of 164 awardees across country in 2015. So I think we submitted the grant in something like October of 2014, and we heard the announcement that we got it in May of 2015. And in typical federal fashion, they gave us 120 days to become fully operational as a community health center. So we were born on September 1st, 2015 as North Olympic Healthcare Network.
There you go. Hence the 10-year anniversary coming up in September.
Exactly.
Right? Now, from those first days, though, you have had a tremendous impact. NOHN has, take us through. I mean, you've expanded immensely, not just medical doctors. You've brought in dental care, vision, all sorts of things. I mean, really trying to plug holes wherever you've been able to find them as far as access goes.
Yeah, that is one of the things that, as a clinician in me, that was attracted. I could provide more for my patients than I could just as a family doc. Health centers, what's interesting about this model is it was the very first, and it was radical back in the 1960s, but this idea that you have all your services in one place. And we go like, well, it's a no-brainer now, but then it was radical. You get, when you have all your different providers communicating, sharing records, it's called integrated care, where they're all in one place. You just get better outcomes and at lower cost. So health centers are required. If you are a health center, you have to bring in all of these required services. Either if you don't do them directly, you have to make sure your patients have access to them. So that was a big attraction for us. And we systematically started out with primary care and behavioral health, and then we initially worked a way for our patients to get access to dental care through Irwin Dental, but then we were able to open up our own dental clinic in 2019, then opened up a vision clinic in 2023. to make sure our patients could get access to these services. Particularly if you're on Medicaid, you struggle to get access otherwise unless we're providing them. And then just last July, we opened up a pharmacy.
Yeah, you just kind of keep going. We'll talk about the future in just a moment. How many physicians have you brought into town, though?
We have brought, honestly, lose count. I think we are at 15 or 16 physicians that have come into the community because of us, and part of that is because of our training program that you've had some.
Yeah, obviously that's going to get next to as well. You talked about attracting docs to come and be in a rural area. One way is to train them here.
Exactly, and it's been Dr. Epstein. He just retired.
Yeah.
It was his vision to get this residency going, and as a private practice, it was difficult or impossible. Under the health center, it was a better place to do this training, and so we've been successful. We brought in, I think we just graduated our 6th cohort of residents, and we have had 6 of those. I think it's 18 residents that have actually stayed in the community.
Yeah, which is great. I mean, that's a tremendous return on that investment.
It really is. It really is.
Well, once you kind of get around this place, people tend to say, it's not too
so
bad
here. Yeah, totally.
Right. Okay, so let's before we went on, I was going to say that we've been watching what's going on with the federal government, some of the things like that. And I guess, what does that mean for the future of NOHN? And I'm sure you have plans of what you'd like to do, but now you're kind of probably going, well, can we? Yeah,
this change, even though health centers have had bipartisan support through their history, this administration has just had a little different focus, I believe, and this one big beautiful bill. I have a different word for it, but it's it really has gutted funding through Medicaid. And Medicaid is, we see many patients with Medicaid, and when those patients no longer have Medicaid, they become uninsured. Now, because we are a safety net provider, we see anybody who walks through our door, regardless of their insurance or not, and we will see those patients. But instead of actually getting reimbursement from Medicaid, we will get a sliding fee. So basically, we reduce people's charges from based on household size and income all the way down to 0 if they qualify. And so we'll still see the patients, but we won't have the revenue. And it is a little daunting to think both with Medicaid and what's often overlooked in this bill is that the Affordable Care Act, the marketplace subsidies for commercial insurance, those are going away as well. So many of our commercially insured patients are going to lose their insurance because they can't afford it because they'll lose the premium subsidies. So one estimate was that, and I shudder to think about if this ends up being true, but between 50 and 65% of our Medicaid patients and our commercially insured patients will become uninsured.
Wow.
And it's a little daunting to think about.
Well, and from your perspective as well, you're still going to treat those folks. It's just, how do we pay it? Because you got to keep the doors open and the lights on and paying for people to be there to do the work.
That's one of the reasons my hair is even a lighter shade of gray in the past 6 months. Yeah.
All right. You're still kind of in a wait and see, though. It sounds like.
Yeah. Well, the impacts on Medicaid are going to be phased in after the midterms. So there's some time to kind of do some planning. There's some hope that calmer heads will prevail, and they'll see what this really is doing some really bad things to healthcare, especially in rural America. It doesn't affect just health centers, but every provider, rural hospitals are all going to be negatively impacted. And maybe there'll be some mitigation or some rolling back of this, but we have some planning to do to figure out how we provide services with fewer resources.
All right. Generally speaking, that said, let's be a little more Pollyanna about it. Let's. What do you see is next at NOHN now? What do you hope to happen in the next few years?
We are bringing on new providers. So 2 of our graduating residents from this year's class are going to be joining us in the fall. We have a nurse practitioner joining us just out of her training. So we have more primary care available. We are bringing on another optometrist. And so we'll be able to expand our capacity to do that. So those are the top things on our list. We were scheduled to open up we're in the process of opening up a clinic in Forks until the One Big Beautiful Bill took away our funding. So we're finding ways of bringing services out there through our mobile clinic not quite the same, but we are filling a niche there, and we're going to continue to work that way.
Now, we should talk about that too. The mobile clinic is an important addition to what you've done in the last couple of years.
The mobile clinic was really it was a idea that to give us some flexibility. It was right before COVID, and in fact, it got delayed because of COVID. But it was a chance to be able to bring services to wherever those services were needed. Sometimes the transportation, just the location, is a barrier to people getting care. So we can bring services to them, and it takes away that barrier. And it's kind of a Swiss Army knife. We can kind of use it different ways, different places, different people. We used it with the school district quite a bit, especially around the pandemic. Now we're using it in the West End more. We've been up at the Peninsula College, Boys and Girls Club. It's a real nice, flexible tool to. It doesn't really do high volume, but it does very targeted, high impact services.
All right. Looking at all that you've just mentioned, I mean, we've got healthcare in disarray in many sense. I mean, even here locally, there's news being made as we speak. How does NOHN kind of fit into all of that as well? Because we've talked about this, but you partner with all these folks, but you are your own entity as well. People should realize that. Yeah,
it's a good point. I think in my earlier conversation with you, Todd, it was when we first came up, they thought we were just, we were OMC, or we used to be FMPA. We're the hospital. We're not. We're our own entity. We're governed by a board of patients. We are our own 501c3 nonprofit. But we do collaborate, and it's a big part of what we do. And in most rural communities, and especially in Clallam County, we are in a place where it's a tightly woven ecosystem. So when one of our partners is running into some challenges, it does impact us and our patients, and so we're watching, and the hospital's working through it. The funding challenges, really, that's at the core of what they're. As you said, it's hard to maintain services when you are paid less than it costs you to provide those services. So they're working through options for addressing that. And I am a little concerned that when these Medicaid cuts hit and there's more uninsured, that often means that more people end up in the emergency room. And so there'll be lots of conversations to try and coordinate. We want to help. We all want to kind of do our part. NOHN, OMC, and Jamestown work real closely together to make sure that people get the care they need.
All right. Do you think you'd make 10 years? Going back now, looking at this now.
Do I think I'd make 10 years?
Yeah, it was a daunting task, because I remember the conversations when this happened. It was like, well, let's see what happens.
There was being a little bit naive about exactly just how big a lift this was. I thought in the beginning I could see patients and run a health center. Sure, why not? But I had to hang up my stethoscope 4 years ago, but I feel real confident that as the health center program, because it's the history. I mean, it's rooted. It's such a successful model, and it really is impactful, and it has been able to demonstrate it really gets better outcomes for less cost. It's actually 24% less costly with better outcomes. So the model works, and it's just a matter of kind of making it through this political season and finding a way to. Just continue to do our work, and I'm confident we'll be here. That's the one thing I feel very good about, is this transition from the private practice into a community health center. Is this thing will be here long after I'm gone. It is basically an investment by the federal government into our community to ensure that there is health care for everyone in perpetuity.
Mike's great to see you again. Thanks for stopping in. Dr. Mike Maxwell there. He is the CEO at NOHN, and they're celebrating their 10th anniversary, and it's also the 60th anniversary of health centers in our country as we know it. So it's very informative. Thanks, Mike.
Thank you, Todd.
All right. We'll take a break.